it's been a minute since I last updated you guys, but we completed our pathophysiology class today. I needed a 90. I needed a 90 to keep my A in this class. Guys, guess what I got today? Guess what I got today? A 90. Oh my God. I wish I was documenting about my journey on like TikTok and Instagram, but it's fine. I'm documenting for YouTube because only God knows how long TikTok will be open, one, and two, like I don't want to talk about it until I'm done with my journey. Like for example, this video now, I'm not even uploading it till like next year. So I'm recording this in 2025, but you won't see it until 2026 or 2027. So yeah. But anyways, yeah, guys, like I needed a 90 and I did just that. Shout out to God. Like I stayed up till like 3-4 a.m. for the past like 2-3 days now, trying to understand and like really get to the nitty-gritty of what each topic was talking about. And I'm so grateful that I did that because it not only prepared me for the exam, but I now understand like, you know, what the concepts mean and everything. My period also started today, so yeah. I'm hoping that I won't cramp too bad within the next 2 days because we also have health assessment coming up. For health assessment, I'm not gonna lie, I'm kind of worried, but it's either I pray or I worry. I can't do both, so I'm gonna choose to pray and just study. But yeah, instead of me to like, you know, go outside and buy McDonald's and Chick-fil-A like I usually do whenever I start my period, I decided to eat my meal prep. So I'm watching a Nigerian movie and eating my meal prep. It's not Chick-fil-A, but it's gonna get my body right because this weekend is 4th of July and I'm going back to Houston to, you know, boogie down and celebrate. But what was I saying? Dang, I literally lost my train of track. But yeah, I'm just gonna unwind, watch this movie really quick, and then get right back into it, like for studying for health assessment because I need a 96 for that one to get an A. Right now I'm at like an 87. And you need an 89.5 to get an A. So wish me luck, guys. Pray for me. I know this video is going to come out later, but just be praying for me even along this journey. But yeah, so I'll just keep y'all updated. Hopefully I remember to like record it. But toodles, I'll see y'all later. Just keep on pushing.
He owned a couple acres, a couple fake visas, cause he never got his papers. Gave up on love, fucking with them heartbreakers. But he was getting money with the movers and the shakers. He was mixed with a couple things, bought like a couple rings, bricks in a condo and grams to sing. Left arm, baby mother tatted, 5-year bid up.
I'm going to take out the alcohol swab. I'm going to wipe down her finger and let it dry. While that's drying.
Wait, don't fan that because we're not supposed to fan it.
You're not supposed to.
Yeah, because that's like
because
bacteria.
all the bacteria in the air, you're bringing
Oh
it there.
my God.
But
Wait, don't reuse it.
you will see all the time in the hospital people are doing
Use
that.
another alcohol pen. I'm sorry, I'm boss.
A different one?
A different alcohol pen.
You know what mistake you did it, right?
Oh, like fanning?
Yeah.
Okay. Hi vlog, it's your girl flowbabez coming to you live and direct. I don't know where this is gonna fit into the vlog, but I have my head to toe assessment coming up on Friday, so in like 2 days. Today's Tuesday and I have to have this down. So yeah, I live by myself, as you guys know, so I'm gonna have to like do it on this contraption thing I just made. I don't know, but yeah, I'm just gonna test it and see how much I remember. But yeah. About living by yourself. Oh, the TV just turned on. Yeah. Anyways, so I'm gonna knock. I'm washing my hands. Hi, how are you today? My name is Fleur. I'm going to be your nurse for today. Could you please verify your name and date of birth for me? All right, great. And how are you today? All right, so today I'm going to be performing a head-to-toe assessment on you. And I'm going to be starting off by observing your head and face. So, for a general survey, patient appears to be stated age. Patient's speech is articulate. Patient is seated upright. Patient is dressed appropriately. Okay, so now I'm going to move on to observing the head and the face. So I'm going to inspect the head and skull for size. I'm going to palpate the head for lumps. I'm going to palpate the head for lumps. I'm going to inspect the scalp for scaliness and lesions. I'm going to inspect the hair for color, distribution, and quantity. I'm going to inspect the face. I'm going to inspect the face for swelling and symmetry. I'm going to inspect the facial skin for color and condition. I'm going to inspect I could be a lot faster than this. I'm going to test what did I just say right now? I'm going to test the facial nerve. Could you smile for me? Could you frown for me? Okay, great. I'm going to inspect the area anterior to the TMJ. I'm going to palpate the TMJ for tenderness. I'm going to test the TMJ for limited range of motion by observing for pain, crepitation, and limited motion. Could you open for me? Could you close for me? Could you protrude for me? Could you move from side to side for me? Okay, great. And that concludes my, and now I'm going to move on to inspect the eyes. Knock, knock. I'm washing my hands and I'm introducing myself to the patient. Hi, my name is Flora. I'm going to be your nurse for today. Could you please verify your name and date of birth for me, please? All right, thank you. I'm gonna start off with the general survey. Patient appears to be stated age. Patient's facial expression seems to be content. Patient's speech is articulate and understandable. Okay. Speech. Knock, knock, knock. I'm washing my hands. Hi, my name is Flora. I'm going to be your student nurse for today. Could you please verify your name and date of birth for me? Okay, great. I'm going to start off with the general survey. Patient's level of consciousness seems to be alert and oriented. Patient appears to be stated age. Patient is seated upright. Patient is dressed appropriately. I'm going to start off with the head and face. I'm going to inspect the head and skull for size. I'm going to palpate the head for lumps. I'm going to inspect the hair. I'm going to inspect the scalp for scaliness and lesions. I'm going to inspect the hair for color, distribution, and quantity. I'm going to inspect the facial skin for color and condition. I'm going to test the facial nerve. Could you smile for me? Could you frown for me? No. I'm going to inspect the face for swelling and symmetry. So it's the first day of clinicals, and we're getting our steps in and walking over to the hospital.
Yes. How do you feel today, Flora?
I feel kind of nervous because I don't really like blood or vomit.
Oh.
Or today we're in oncology, so
Yeah.
I don't like the C word.
Oh,
So
yeah, horrible. Oh.
Yeah.
My heart goes out to all those patients.
Honestly. But besides that, I feel good. Sorry.
Yes. Oh, yeah, no.
Yeah, I'm out of breath.
Whew.
Woo. Do you have anything else to say?
What are your expectations for today?
I expect to learn a lot,
Yes.
honestly. Like, I'm opening up my mind to learn a lot. So anyways, I never showed you guys my customized jacket or whatever. So, but yeah, we'll see y'all later.
mate.
All right, I'm going to be inspecting the posterior thorax. I'm going to inspect the posterior thorax for muscle deformities and muscle retraction and skeletal deformities. I'm going to inspect the skin for color and condition. I'm going to palpate the chest wall for tenderness and masses. I'm going to identify the location of breath sounds for bronchovesicular, which is in the C7, and then I'm going to identify the breath sounds for vesicular, which is in the peripheries. Then I'm going to auscultate and listen for adventitious breath sounds. So I'm going to start off with the upper lobes. I'm going to go next to the bronchi medial. Then I'm going to go to the lower lobes, and then I'm going to go to the lateral sides. And then I'm going to percuss. I'm going to percuss for CVA tenderness on each side. Let me know if that hurts. All right, and then we're going to move on to the anterior thorax. So now we're moving on to the anterior thorax. The patient will be in semi-Fowler's position. I'm going to note the respiratory effort by observing the facial expression. I'm going to inspect the anterior thorax for muscle retractions and skeletal deformities. I'm going to inspect the skin for color and condition. I'm going to palpate the skin for color and condition. I'm going to palpate the skin for tenderness and mass. I'm going to palpate the skin for tenderness and masses. I'm going to identify the anatomical positions for different breath sounds. Bronchotracheal will be in the trachea. Broncho-vesicular will be around the sternum, and then the vesicular will be around the peripherals. And then I'm going to auscultate. And listen for adventitious sounds. So I'm going to start off with the apexes and work my way down, and then I think that concludes it. Good morning, vlog. So I'm so sorry I've not been updating you guys on like life in general, but we finished like the first half of this first semester, and now we're on to the second half of this first semester. By the end of this month, or actually it's July right now, so by like the middle of August, we should be done with my first semester of nursing school. But yeah, today we have our first exam for foundations. Wish me luck, because I'm not gonna lie, I didn't really study. I felt like it was pretty straightforward, but hey, it's nursing school. Sometimes you can underestimate, and then, you know, but let's get it, Sha. I'm exhausted. I'm tired of exams every week, but I signed up for this, so I'm just gonna have to see it through, you know?
Okay, go.
She came up to our floor and she was just hanging out with us until it's like 9:30 when they her surgery started. Or her nurse's surgery started. Oh, but she got to see
Where?
She got to see surgery. Good.
Yeah, they combined different.
Good
Bad for a sleepy girl.
Yeah. Wait, look at that. It's actually a straight line. I mean, it's kind of like a straight line.
Yeah.
So this hurts.
I got it.
Wow, good job. Don't underestimate this girl.
Girl.
Period. The OR hates to see her coming.
Exactly.
Okay.
Was this an OR job?
It could be, right? An OR. It's like a perioperative nursing, right? Yeah. Okay, perioperative nurse.
I think I found my calling.
She found her calling, you guys.